We will now look at various stapedial reflex patterns in various disease states. Let us look at a pattern where there is a normal hearing on the right ear and mild conductive loss in the left ear. Here, the probe tone is in the right ear, the stimulus is on the right side, and we find that on the right ear, the ART is 85 decibels. However, in the left side where there is a mild conductive loss, the ART is 100. This raised left reflex thresholds are due to additional sound pressure levels needed to overcome the mild loss in the left ear. The middle ear pathology may affect signals traveling through the left ear or being measured in the left ear. They will either be absent or raised. This is a pattern showing normal hearing on the right side and moderate conductive hearing loss in the left. And here we find that in the right ear, which is normal, the ART is 85, whereas on the left side where there is a moderate conductive hearing loss, the reflexes are absent. Here, the stimulus was not loud enough to elicit a stapedial reflex in the left contralateral recording probe. In otosclerosis, initially there is a biphasic response, and once the footplate is fixed, the ipsilateral reflexes are absent. Cochlear hearing loss. In ears with a cochlear hearing loss, it is possible for the acoustic reflex to be elicited at sensation levels of less than 60 decibel. What do you mean by sensation levels? The sensation level is the difference between the acoustic reflex threshold and the hearing threshold. For example, if the hearing threshold at 1 kHz is 50 dB and the acoustic reflex threshold is 90 dB, the sensation level is 40 decibels. When the sensation level is less than 60 dB, a positive METS test is indicated. This indicates a cochlear site of lesion due to the loudness recruitment phenomenon. Retrocochlear hearing loss. ARTs in ears with retrocochlear pathologies are usually elevated above what they would have been for normal hearing or a cochlear hearing loss. Often they are absent at maximum stimulus levels. Keep in mind that ART results should be analyzed in combination with the patient case history, audiogram, speech, and tympanometry findings for differential diagnosis. There are certain things to note. These are: ears with retrocochlear pathology and normal hearing do not have reflexes 30% of the time. With a mild 30 dB hearing loss, the likelihood of absent reflexes increases. The absence of reflexes at 0.5, 1 and 2 kHz in the presence of normal or near normal hearing must be considered suspicious unless proven otherwise. Let us have a look at a pattern wherein there is a retrocochlear lesion in the left ear, a mild hearing loss in the left ear, and normal hearing in the right ear. The probe tone, when it is in the right ear and the stimulus is on the right, we find that the ART is 80 decibels, whereas there is absent reflexes on the left side. When the probe tone is on the left, then we find that reflexes are absent on the left side, where there is the retrocochlear lesion. This case has a mild hearing loss in the left ear and a normal hearing on the right side. And in this case, we find that the contralateral reflexes are present on the right side. Facial nerve involvement. Acoustic reflexes are absent when measured on the affected side in the case of facial nerve disorders. This is because the stapedius muscle is innervated by the seventh nerve. However, seventh nerve disorders are easily recognizable, and hence measurement of acoustic reflex is used more as a tool to monitor the recovery process in such patients. This is the case with a facial nerve lesion on the left side due to Bell's palsy with normal hearing in both ears. And in this case we find that on the right side where the hearing is normal, the acoustic reflexes are present, whereas on the left side the reflexes are absent. Intraaxial brainstem lesions. These are very rare, occurring 1 in 10 million. The acoustic reflexes are normally ipsilaterally and absent contralaterally. The left and right pathways are disrupted by a lesion involving the auditory fibers. Reflex decay testing. Acoustic reflex decay testing can be useful in detecting or confirming retrocochlear pathology in patients. Generally, patients will present with typical retrocochlear indicators. These are unilateral tinnitus, asymmetric hearing loss, and dizziness or vertigo. This test may be useful though when the audiogram and case history are normal, but reflex results show a retrocochlear pattern. Acoustic reflex decay test measures whether a reflex contraction is maintained or weakens during continuous stimulation, usually of 10 seconds duration. The testing is usually conducted at 500 and 1000 Hz, but not above these frequencies, as even normal ears can show decay at higher frequencies. The test is performed by presenting a continuous stimulus 10 decibels above the ART for that frequency for a period of 10 seconds. Either the magnitude of the reflex response will stay the same or decrease over a 10-second period. What one is looking for is whether or not the response decays to half its original magnitude. Therefore, if the reflex response decreases to 50% of its original magnitude within the 10 seconds of testing, the test would be positive for reflex decay. Here is a documentation of the acoustic reflex decay test. We find that if the magnitude falls by 50% or more, we consider that to be a positive reflex decay.